Representative Valencia Stovall with a special announcement. Amen. Roll the video, please. Please start the video.
Last night, we reported on the expansion of Medicaid in North Carolina, one of a number of states once opposed to doing so. Medicaid has grown substantially over time. More than 90 million people now are on it. But the end of the pandemic is also leading to another big change with Medicaid. As many as 14 million people could lose Medicaid coverage in the months ahead. William Bryan has the details.
Before the pandemic, people had to re-enroll every year for Medicaid by submitting paperwork to prove that they were eligible. That was suspended during the height of the pandemic and afterwards. But starting this month, Medicaid recipients have to make sure they are enrolled again. The problem? Well, there are many among them. Not everyone will receive a notice or complete the applications on time. Many will fall through the cracks due to changing addresses or language barriers. We'll hear about these problems and the efforts to re-enroll people in a moment. But first, let's begin by hearing some of the folks on the ground trying to help recipients get the coverage they need.
The thing is, there's not enough advocates to assist every person who's going to be unenrolled from Medicaid in our state. So what we're trying to do collectively in a coalition is to get as much information out into the community as we can and do that education.
Florida is one of now just 10 states that has refused to expand Medicaid under the Affordable Care Act, which means we're going to end up with a lot more individuals who don't have any health coverage. And those people are going to be reliant on places like their local community clinics, federally qualified health centers, and charity care. But that's not health coverage. That may be access to care, but it's not coverage, and it comes with costs.
Much of the application process is online, and we know there's digital equity issues in these transient and LEP communities as well. So there's a lot of hurdles, there's a lot of gaps, there's a lot of barriers.
There is significant room for error in the renewal process, and missing a key communication from the state. In fact, a significant portion of cases will be closed due to those sorts of procedural errors. And so for those people, they're going to have to start again at the beginning.
So we're trying to be as proactive as we can be to educate multilingual community members on what this process is, what to look out for in the mail, and to contact us if they need any interpretation assistance.
Harper, under your leadership, we appreciate you. I am Honorable Valencia Stovall. I'm a former state legislator, served 8 years down at the state capitol. And I want to thank Evangelist Mary Ward Cater, the president of the South Central Georgia Jurisdiction Political Action Committee, and the members of that committee for bringing to my attention the need for Medicaid expansion, the need for Medicaid coverage in the state of Georgia. I don't know if you all know, but over 500,000 people lost their Medicaid coverage in Georgia. And that was as of September of 2023, which was just last year. Majority of those who lost their coverage are children, our senior adults, and the disabled. Most only find out when they end up going to the hospital. And that's the wrong time to find out because the doctors could not service them if they lost their Medicaid coverage. And this past Saturday, we were fortunate to be at Paradise Community Development Center, the gymnasium up under Bishop Fortson and Elder Paul Quentin Fortson. And we were able to bring out the state workers. We had DFACS workers. We had the Health and Human Services there. We had the Federal Center for Medicaid Services on, so we had the state and the federal there. We also had Georgia Stand Up, which is another organization working in the community. And we will have another event coming up on Saturday, March the 23rd. March the 23rd, mark your calendars. It's going to be here at Kelly Lake Church here from 11 a.m. to 1 p.m. And I want to also let you know that Georgia had the highest number of children who lost coverage due to paperwork error. So it was just paperwork error. It wasn't because they were not supposed to be included. And what happened, there was a federal mandate. Everybody had coverage during the pandemic. After that pandemic, the federal government said all states, all 50 states, had to recertify all of their recipients who were receiving Medicaid. And what happened, those over 500,000 during the recertification process lost their coverage. And like I said, majority of them were children. 2.8 million Georgians need to check their coverage. And that's our charge to each one of you all today, is asking your neighbors, asking your church members, anyone that you know to check their status for Medicaid. They may be thinking that they are covered and they are not covered. And we don't want them to go to the hospital at the emergency just think of having a child that's sick, especially with the changing of the weather. And they go to the hospital and that child can't be seen. Or someone that needs dialysis, was a case that we heard of that needed dialysis transportation, but could not get it. So it's a very serious issue in our community. I heard earlier they were talking about insurance, talking about health. This Medicaid is very serious. And so our charge to you all is to make sure you spread the word. And we have taken on this cause for Souls to Medicaid 911 because it is an emergency. And the second event, like I said, would be Saturday, March the 23rd. And in closing, Proverbs 31:8 and 9 says, "Speak up for those who can't speak for themselves, for the rights of all who are destitute. Speak up and judge fairly. Defend the rights of the poor and needy." And with this loss of Medicaid, that's what we have to do as a church body, is defend the rights of the needy. And the only way they would know is if we spread the word that they need to check your status. They can go to their Gateway website, and we will have workers on site on the 23rd that will be able to check their status on site. So please spread the word. And thank you again, Bishop Harper.